Hello everyone, my name is Mohammed. I'm one of the doctors working in northeast of England. On today's video we are going to talk about chest x-ray, which is one of the most common examinations that is done in hospital. One of the most common reasons for doing the chest x-ray is infection, fluid overload, and cancer, and we're going to talk about them briefly today. So first of all, looking at a chest x-ray, we can see these are lungs, and we have two lungs as you know. And the benefit of having two lungs, especially from a chest x-ray perspective, is that we can compare one side to another and see if there's abnormality, and that helps us figure out if that requires further investigation. So the lung, normal lung looks gray. As you can see, this is air, looks gray on a chest x-ray. And on this examination, as you can see, these gray bits are your air. This white bit overlying are bones, these are ribs, but the gray bits are air, and air is within the lung, so therefore this is normal lung. You can see air over here because this is part of the bowel, because bowel also contains air. Anyway, coming back to the chest x-ray, so the normal lung looks gray, and that is normal. However, infection looks whitish, and the reason for that is it's full of fluid, and fluid looks white on x-ray. So therefore, if I had whitish bits over here in a cluster, I'll be worried that there might be an infection underlying that. Similarly, fluid, as we said, fluid looks whitish on a chest x-ray, and fluid overload, which is another reason that we do chest x-ray quite often, will look white. But fluid overload is something that is seen in organic failure, such as heart failure, liver failure, kidney failure. And what happens is body is unable to excrete fluid appropriately, and there's a buildup of fluid, and in that situation the fluid can leak into the lungs and through these vessels. So this is a big vessel, this is a big vessel, and through these vessels, these white little bits are vessels, and through them the fluid can leak out and collect lower down. So if there is both sides whitish bits, especially on the lower side, that makes you wonder that maybe there is an underlying fluid overload, and one starts looking for causes of that. If the heart is enlarged, which is the length of the heart more than half the size of the entire chest, if it is more than half the size of the entire chest, then that makes you wonder if there is an enlarged heart. And if there is fluid overload, then you would consider that the heart failure is the cause of this fluid overload. But if the heart is normal in size, but there is still fluid collection on both sides, then you would worry about other causes of fluid overload, such as liver failure. And the third thing we're talking about today is cancer. And cancer presents like a nodule or a mass, and essentially if this type of thing is found in the lung, so for example, if I found this over here, I'll be worried that the patient might have a cancer. One of the things that can help me decide if it's more likely to be cancer is the border of the nodule. If the border of the nodule is irregular or spiky shaped, then that is more likely to be cancer. Cancers are usually found all over the lung, but usually on the upper part of the lungs, and if they are there, then that makes you wonder that there might be underlying cancer. And cancers can often present with multiple different nodules, so there might be more than one nodule. Cancers can also cause destruction of bones, so these are ribs, and as you can nicely see, the ribs following a nice curve and similar appearance on the other side. If there is cancer, the rib might be missing. So for example, if I go here, and if there was a cancer destroying it, so the rib might be seen from here to here, and then from here to here, and the middle bit might be missing, and that might make you wonder there might be an underlying cancer. So these are common things we see on a chest x-ray. One of the most common, some of the most common reasons for requesting a chest x-ray. I hope you found this video useful, and don't forget to subscribe for similarly educational videos on medical imaging in the future. Until next time, bye bye.